Now, in the practice, these symptoms, which look just like the lexicon of DSM-4 for psychiatry, I have seen in my practice over and over again. Panic attacks, long-lasting. An executive, pilot, triathlon athlete came and said he wakes up in the dead of night, heart racing, short of breath, major panic attack, blood sugar drop. Mood disorders, irritability and rage response, and violence. That's a very common problem. Probably a third of my patients, if they come in with their spouses or their parents, say the personality has changed. He's as irritable at the drop of a hat. It's like walking on eggshells. There was a famous case in Connecticut in which a young man with Lyme took an axe to a neighbor, and I broke down the door. Dr. Jones testified. I saw the youngster. In spite of the proof that he had temporal lobe epileptiform seizures, he was imprisoned for 4-5 years. But certainly there was direct evidence of a Lyme involvement. So mood disorders, very common. If you have a propensity for bipolar illness, it can certainly set it off. So the manic or psychotic episodes. In children and adults, I'm starting to see a lot more OCD. And I think it's a little bit like something called PANDAS, which is an autoimmune disorder that follows streptococcal infections in children. And they can be suddenly OCD-like in their behaviors. Eating disorders are common. Bulimia and anorexia. Of course, depression, and unfortunately self-destructive behavior, suicidal attempts, and sometimes success. Unfortunately, I lost one young man of 31, a lobster fisherman, and worked for the health department in Norwalk, Connecticut. Took his truck out one day by his boat and shot himself with a rifle. So it can produce serious self-destructive behavior. And then now you get the second group. Harder to pin down and harder to understand if you're a physician who's not looking for this syndrome. Cognitive overload, short-circuiting, confusion, and loss of focus. These people can no longer multitask. Whereas before they were juggling 5 and 6 different tasks, taking kids out, doing the laundry, shopping, cooking, if it's a woman, a mother. And now the laundry is sort of in piles. They forget where they are. They can't sequence a meal. They'll put part of the meal into the ice box. They'll put the roses into the dishwasher. They'll pour cream onto a jug that's turned upside down so it spills on the floor. Real confusional states. And then brain fog, lack of clarity in terms of self, place, and person. These people literally lose their identity. They can be in a familiar setting like their own street and not recognize it, not recognize their own home. Very frightening if you think about it. And yet these are not symptoms that at this point in time have come into the consciousness of most of the medical profession. The mind-body split is very, very dramatic now, I think, in modern technological medicine. The mind is really the province of the psychiatrists. And psychiatry now uses mostly neuropharmaceutical products. But it's a whole untapped reservoir of problem that people don't know what to do with. They know they're not crazy. They know they don't need a psychiatrist. but something is going on dramatically and they can't place it. Red flag is sensory hyperacuity, very sensitive to light, to sound. Often patients will come in with sunglasses, they need earplugs to sleep. Touch, they don't like to be hugged, they don't like to be stroked. Their spatial orientation is lost, which I just mentioned. They'll also bump into objects. They'll have disequilibrium, the problem with the cerebellum. And of course, speech and fluency. People who ordinarily, teachers, lecturers, psychologists, who are usually very fluent in their ability to speak and to communicate, struggling to find words, switch words around. Like they may go cow for dog, or they may say sheep for sleep, or they may go, what's the name of my son? Gosh, that tip of my tongue. Things of this nature. And then finally, the demyelinating problems, which look a lot like MS and ALS, and that's a whole area of controversy which becomes a real issue of diagnosis. And the treatments, of course, are antithetical. For MS, you often use interferon and steroids. Not a good idea if it's an undiagnosed Lyme problem. So you see, you can have psychiatric problems in an otherwise normal individual, or you can have the neuropsychiatric symptoms which you can't really talk about because they don't mean anything in today's context. They're not red flags for the treating physician who really wants to help. They're in the literature. The studies have been done. Brian Fallon's work was a seminal piece of writing 15 years ago. But for some reason, it has not got into the daily workings, particularly in the endemic areas. Like I said, other neurological diagnoses in otherwise puzzling individuals. Atypical multiple sclerosis. I don't know how many times I've heard that. Systemic lupus. Early Parkinson's, ALS, and Alzheimer's. And whenever I hear any of these illnesses in anybody, certainly under 40, I immediately throw up a red flag. And I'm going to work real hard to find some tick-borne disease. I'm very prejudiced. You have to understand that. I'm extremely biased. So you have to sort of put a variable in there about my bias, because once you see this stuff, you get a little crazy because you just see it all around, and it's quite frightening. To that point, can I have a show of hands of those in the room who have personally, their own person, been affected by Lyme? Can I have a show of hands of how many have had a loved one, a close family, blood relative, afflicted with Lyme? Look at that in this room. It's astounding. And unfortunately, we don't have the medical power yet to deal with it, because it has still not risen, I believe, to the level of awareness because of some of the reasons that I showed you before on that diagram. Stress will activate Lyme. So an asymptomatic patient may reactivate their infection following stressors of various kinds, like trauma, surgery, intercurrent illnesses, flu, taking another antibiotic for an unrelated reason like sinusitis, or psychological stress, like a death in the family, or having received the infamous Lyme vaccine. So stress can affect the neuroendocrine system, which can directly affect how Lyme might present in in the future.